So what are the signs and symptoms of dyslexia? We know from experience that dyslexic students will tend to have quite scruffy handwriting. But there's a reason for that, and we have to be careful when we are stigmatizing students with things like scruffy handwriting or unable to read. Yes, those are some of the signs that somebody is dyslexic, but not always. It's not always true. One of the main signs that a parent or a teacher should be looking for is if the child is actually yawning or seems really tired in their class. This is because a dyslexic brain, is bigger, as discussed in the last video, but it also means that a dyslexic person is working 10 times harder to process the information that's been presented to them. So you imagine being given Sanskrit and being asked to read a text of 4 pages of it and then answer questions. That's kind of how it is for a dyslexic person. A bit of an exaggeration, but the dyslexic person is working really, really hard to try and process that information that's been given to them. Verbally sometimes, and visually definitely. So if you see a child, or your child, or even you've noticed yourself you're yawning, then that's one of the key signs that a professional should be looking out for. Another sign is that the child will complain that they're having some pain here. Although a sign of dysgraphia as well, it means that the student is trying to write down as quickly as possible the information that's been placed on the board. The reason that their handwriting therefore is scruffy, or in essence looks scruffy, is because the student is trying to copy down information that they have not understood. And so therefore it is important for a professional, a teacher, or even for a home educated child, yourself as the parent, just to allow a little extra time for the child to be able to copy down the information if that's the task that they're doing. Other signs can be more extreme, such as an anxiety around school. And I, as a tutor, am seeing this a lot. Dyslexic students being really anxious about going into the school setting because they find that they are being rushed, they're not giving the time, they daren't put their hand up and ask the teacher if they can have any help because they're worried that the teacher is going to just repeat the information in the same way. And so there's a lot of anxiety around school and education, and that's another big sign to look out for. Does your child actually want to go into school, or are they feeling anxious about it and trying, just to say that no, they don't want to go, or making an excuse not to go, or actually breaking down and crying. Other signs are not so visual to somebody who's looking. And they can also include, and are not exhaustive to everybody, but they can include that the child is a slow reader or seems to read but then cannot tell you what's happened in the text. So reading comprehension perhaps is really difficult for a dyslexic person. Recall is a problem for dyslexic people as well. Another sign to look out for, and this one you may, if you experience it with your own child or yourself, you may think is just part of your own personality, but it is a sign, a giveaway of dyslexia, and that's having a poor short-term memory. So when we look at this in an everyday situation, it means that you pop your keys on the table and then forget what you did with them. But for the student in school, they may have letters to bring home or a PE kit to take or certain books to take, which they forget from time to time, or more often than not, I should say. And that's another key element. So, you'd be watching your child and be taking their lunch things out of their bag or just checking for PE kit. There's a bunch of letters from school which have just been stuffed in there and forgotten about. If you're unsure about that, you can always just ask your child to do a series of maybe 4 or 5 tasks and see how many are actually completed. But the tasks must be run together. So take your coat upstairs, then can you fetch my bag and just put it in the living room before you go and get that book that's on the table. If they only get the book that's on the table and forget about the others and tell you that they've forgotten when you ask them about it, that again could be a sign of dyslexia. So with some of these signs and symptoms of dyslexia, how do you go about getting a screening test, or how do you go about being diagnosed as a dyslexic? Well, there are a couple of ways. We just have to err on the side of caution with some of them. If your child is in school, you can speak to the Senko and give your concerns about dyslexia, that you've noticed some of these signs and symptoms and you want to pursue it in a little bit more detail. It's up to the school then whether they continue to have a dyslexia test with your child. With me and with other tutors who specialise in dyslexia, we can offer a service of screening the child for dyslexia. However, we cannot diagnose that, as much as we may know in our hearts and our heads that a child is dyslexic. The screening is a short 45-minute to an hour test that can say, yes, this needs pursuing, or no, maybe actually there's a phonological deficit, and we can look at tuition from that side of things, or if you're going back into school, we can look at providing a little extra help with that. Once the school have a screening test that's done by a private organisation, the parent can, as a parent, you can then continue to pursue the test through the school. Private tests are a different matter. There are dyslexia associations up and down the country, and if you go to the British Dyslexia Association website, you will find your nearest one. They are expensive, and I'm being brutally honest with that. Going through the school, you wouldn't have to pay anything, but going privately, you do. It'll give you peace of mind to know that your child is or is not on the dyslexia scale, or as they put the terms out now, will have traits of dyslexia. Because everybody has different everybody's dyslexia is different, as I discussed in the last video. They now say that it's traits rather than that, yes, you are dyslexic, or no, you're not, or as they had previously, a scale, and you would be mildly, moderately, severe. Those tests with some schools are not being accepted. If you pay privately for a dyslexia test, as much as you would pay privately for an ADHD screening, or you would pay privately for an autism screening, so a lot of schools will not accept them if they haven't come from the school themselves. So it is one, if you are concerned about your child having dyslexia, then it is one to discuss with the school, and to discuss with them if you were to take it privately, which would be done a lot quicker than it would be in school. At the moment, I think the waiting list is 12 months. So if, for example, your child is in Year 6 right now, the screening would not be done in their primary school, but they would pass it on to the high school. So it is one to talk about. For more information about dyslexia, please see the link in my bio to my Facebook page, where I update quite often with regards to tuition, of course, but also with regards to dyslexia. If you would like a quick questionnaire, then please email me. The email is on my Facebook page, and I will send you out a questionnaire for you to answer. You can send it back to me, and we can discuss the best course of action with regards to dyslexia from there. Thanks so much for listening.